Yes, I may have. It's very possible. Yep. Okay, bye.
Welcome back, everyone. I hope you had a nice break and that you're enjoying Dr. Coyne's presentation so far. We're going to get started and view the rest of the presentation, and then we'll have another section of live Q&A before we head directly into our panel.
Welcome back, everybody. It is part 2 of our presentation on fear and flexibility, and I'm Dr. Lisa Coyne. If you're just joining us, welcome. So we are going to move forward and start today by talking about therapeutic relationship and how we would think about this from a contextual behavioral perspective, incorporating acceptance, values, compassion, and commitment. To see how we can best support our clients and ourselves if we're going through exposure-based treatment. All right. Okay. So as we discussed a little earlier, we really want to incorporate acceptance and commitment therapy principles into ERP to support inhibitory learning. And when we talk about exposures from this perspective, we de-emphasize our focus on habituation, although it's lovely when that happens, right? And we emphasize shaping a new repertoire of behavior, a new broad and flexible repertoire that one can engage in to build a life that's meaningful to them, whether or not there's an OCD cue present. Right? And this is really the goal of exposure. So to shape new behavior that's more effective, adaptive, and approach-based rather than, targeting habituation. And so the way that we think about this, as myself and my colleague Ben Sedley have written about in our book for adolescents, is to really think about shaping these 4 kind of pieces. One is curiosity about one's experience, right? What will happen if I engage in this exposure, if I try this new thing? If we're using the DNAV model, which we learned a little earlier, what happens if I venture out of my comfort zone into my discovery zone? Willingness, right? That incorporates acceptance of whatever thoughts and feelings are showing up in the moment, willingness to allow, okay? And that's critical to, it's foundational really to the experience of engaging well in exposure, because exposure is about way more than just doing the scary thing. It's about really noticing and allowing and exploring the experience of when you're approaching the scary thing, right? Giving a crap. That's the values piece of ACT. And of course, we wrote that book for teenagers, so we used words like that. But framing doing exposure-based treatment in the context of something much bigger, something that's much more motivating than just feeling less anxious. That's not enough. We need to build a life that you love waking up into every day. And then teaching flexibility, right? And that's that discovery piece of shaping broad adaptive repertoires that are context sensitive rather than directed by whatever OCD rules we have in our heads to do. So we don't often talk too much about therapeutic alliance when we're doing our exposure work, but it's important, right? And so when we think about what we mean about therapeutic alliance, and we frequently work one-on-one with clients, we have lots of ERP coaches that are our milieu staff or our counselors who are working with people when they're coaching exposures in the field, right? And so I do want to talk about this because it's important, because very frequently we do exposures, unless we're doing them in between sessions on our own with someone else present, right? And so the ingredients of therapeutic alliance that we think about, and as have been measured in the literature, are task agreement, right? That contract. What are we doing? What's the work? Could be the ERP hierarchy, for example. And bond, which is, a feeling of warmth that you have for your therapist, this bond and trust. Okay. And across the literature in general, this is not specific to any one tradition. It's a pretty robust predictor of outcome, right? And it's associated with outcome. It could be bidirectional, that when you are doing well, you really like your therapist, or vice versa. But I think it's important to think about here, right? So just a little bit of a dive into the literature, not a super deep dive, but some. And so in terms of whether it's important to exposure and response prevention, the literature is mixed. It depends, right? So there might be not a huge direct effect on outcome, but what it is helpful with is it's helpful with treatment adherence, right? And it would make sense that if you and your client, or you and your therapist, agree on the task, you're more likely to do the task, right? So task agreement did predict outcomes, although ERP, exposure and response prevention, was still the most robust predictor of outcome. And given that we are in the middle of the pandemic, or hopefully close to the end of the pandemic, that would be wonderful. And since this has profoundly changed how many of us practice, and I suspect that those changes, at least some of them, will be maintained, at least in part, over time, I thought it might be interesting for you to know that it is actually linked with outcome, not specific to exposure, but when therapy is delivered by on Zoom or via the internet, as we are doing now. Okay. So on this slide, this is a picture of myself and my daughter. So we've been talking about this mountain trek now for several hours, and this is this is above a little village. This is one of our acclimatization walks. Just before the last push, the last couple of days to get to base camp, and we were pretty tired. And when I think about building an alliance with someone and creating a context for treatment to move forward, I think about this visual of sitting together collaboratively and looking out to the same point on the horizon. Okay. From listening to Ethan yesterday for me, but earlier today for you guys, he talks about being made to do exposures, right? And I think one of the important things from a CBS approach is to shape choosing to do difficult things, right? And it's one thing when you have a therapist with you who will tell you what to do and you agree to do that. And it's a completely different thing when you go out in the world on your own and you get to choose. And so shaping choice early on and shaping collaborative work together is important to generalization for that reason, right? Because it's so much harder to do it on your own if that's not something you've practiced already. And so to that end, I think that that piece of alliance is really critically important to doing exposure. So how do we do that, right? So in order to build a bond, right, for this piece, it's important to be compassionate. And I try to always approach my work with people from this place of great humility, where I'm a partner in the work. And I absolutely have a substantive skill set, but that's only 50% of what we need here. And the other 50% comes from that person who's the expert on their own experience, right? And so I spend a lot of time trying very hard to understand and to really feel and empathize with their perspective of what this feels like for them. And if I get to know that in a really fine-grained way, I'm going to be able to design much more effective exposures. I'm going to be able to marshal language that's much closer to what they might need to help set up contingencies in my session to help them move towards doing harder and harder things, right? And I'm going to be praising effort, not outcome, right? So meeting them where they are. And so with creating task agreement, I suspect this is something that all of us do already, right? Collaboratively designing exposure hierarchies or menus, modeling acceptance of your client's anxiety, right? And, I am not shy at all about disclosing my own when that's a useful teaching tool, right? And then, of course, doing what you ask your client to do. If you ask your client to do a hard thing, it's really important to be willing to do it yourself, even if it's hard, right? I dread the day I get someone who's really scared of spiders to come to my office because I know it's going to be a tough day for me because I don't love spiders either, but I could probably do the height exposures. And so I think a lot about this from an attachment-based perspective. Of course, I'm a child psychologist at heart, but thinking in terms of becoming a secure base. Now, some of you are probably going, but that means your safety behavior, right? Maybe, until you think about what the function of being a secure base is, right? And what securely attached infants do that insecurely attached infants do not is they go out into the world and they explore it robustly. And you see much greater variability and exploration in their behavior than you do in infants who are less securely attached. And yes, this is a metaphor, right? But it stands to reason. That's what we want to build for our clients, that safe harbor that they can willingly choose to step out of and try and learn to do hard things, okay? Woo! This is just to make you dizzy. So I want to talk a little bit about how people get stuck and spiraled into that negative reinforcement cycle of obsessions and compulsions as we go. And I'm going to leave this on just because it's really fun to watch this. There, give you a break. Okay. So when we think about the DNAV, right, which is the developmental model of ACT, developed, I don't think I said this yesterday, but it was developed by Louise Hayes and Joe Taraki. And there's a wonderful book called The Thriving Adolescent, and they just came out with a new one for young adults called Your Life, Your Way, a nice workbook. It's not OCD specific, but it's a really nice look at a very flexible and contextual, evolutionary, derived ACT model. So let's think about how do we get stuck, right? So when we think about, let's take, for example, our advisor, which is the verbal part of us. We talked about it as our threat detector. It's the place that evaluates, it's a capacity of evaluating our experience, of judging, of determining whether or not we should take a risk, usually not, because our advisors are pretty risk averse. And it's also the seat of OCD. Do that. If you do that, someone will die. If you touch that, you'll get contaminated, right? And it's where we get a lot of rules about how to behave. So now the upside of this is that it does protect us from danger. That's its goal. It allows really quick communication. We can just listen to it and do what it says. And sometimes it gives us very helpful rules, right? But it has a downside, right? Especially in the case of OCD, it can lead to very rigid rule following. I have this intrusive thought, I must do this ritual. That would be a good example. I must avoid this. It absorbs other people's ideas, even when they're unhelpful, right? And it operates all the time, as we discussed. You wouldn't want to be able to turn off that smoke detector. And it's insensitive to context, right? It can also distort incoming information. And so if you're listening to this, you're probably thinking, Sounds a lot like the way OCD works. Yeah, it is. It really is. And so when we think about skills deficits in our use of this class of behavior, this functional class of behavior, we want to look for certain things, right? And these are the kinds of things we see with cognitive rituals and rumination. That's my little meme here of the it clown. So what you want to look for is, are we overly attached to our thoughts? Do we have that thought action fusion going on, right? How much do we believe that thought, right? How much do we act on that belief, right? So there's an inability to notice thoughts as part of our experience, not the whole of our experience. So this inability to step back. So poor insight about OCD would be a really good example of that. Experiencing thoughts as have-tos or rules. Well, that's OCD in a nutshell, isn't it? Right? So that's sort of speaking to difficulty resisting, doing what those OCD thoughts are saying. Difficulty really noticing like when we need to listen to this advising part of us and when it's not relevant, right? That difficulty discriminating those things. And then finally, treating thoughts as they are dangerous. If I have a thought, I can't handle it. I can't tolerate it. I'm going to try not to think about it. I'm going to try not to say it. Okay. So this is one way we would apply the ACT model. All right. So we're going to move on. So how do we address that, right? How do we fix that stuckness where we're so attached to our thoughts that we get spiraled into this smaller and smaller and smaller cycle, space where we're doing less and less and less and more and more and more rituals and compulsions and things like that. So we're going to talk about how to get out of that. And we're going to talk about how to enhance in exposure inhibitory learning. And then we're going to end our talk with really incorporating those values-based exposures. Okay. All right. So I'm assuming that you guys have some familiarity with this. We talked a little bit about this earlier, about what is meant by inhibitory learning. And just to reflect back on that, really simply, it means that we don't erase associations, we don't unlearn things. What we do is we create new learning. And the idea is, how do we strengthen that new inhibitory learning that competes with that older excitatory fear-based learning, right, from the fear acquisition literature. And there was a lovely paper by Michelle Krask that's really, really, I always cite it because I think that it's just a nice summary of this, of things that you can do in your exposure practice with your clients, very concrete things that will help you maximize your care and your work and really maximize how the exposures are working. And there were 9 specific practices that she talked about, or these authors talked about in this article, that are very, very useful at enhancing your exposure. And we're going to talk about some of them as we go through, but they're all pretty straightforward, right? So we will move on from here. Okay. So the goal of exposures, right? And the goal of, sort of enhancing this inhibitory learning is psychological flexibility, right? And that means when we have an experience, staying, contacting the present moment fully, without defense, as a conscious human being, and continuing what we're doing or changing it in the service of those things that we care about, right? So in other words, even though there might be a fear cue there, which in the past has evoked an avoidance response on our parts, we might experience that fear cue, experience fear, and make a different choice in what we're going to do. That's irrespective of that, right? So it's like having the TV on in the corner and it's on, but you're busy doing other things. You're not even really noticing it, okay? It doesn't have any control, any stimulus control over your behavior. And that's where we're going. So the first step of that is curiosity, right? How do we shape that behavior? And I love this quote by Andre Gide: "Man cannot discover new oceans unless he has the courage to lose sight of the shore." And that is, in fact, what we're asking our clients to do when we're asking them to try out an exposure that they're sure will be awful. So one of the things that we notice is that when folks have had OCD for a while, they're really dominated by their inner experience, right? That experience of, just that focus on stuff they're trying to avoid that shows up inside their skins, really aversive private events, is dominant, and they're not noticing much else in their environment. And when that happens, as we discussed a little earlier, there's very little variation in behavior. So what you see is this rigid pattern of obsession compulsion. And this really constrains opportunities for inhibitory learning. And one of the reasons it does that too is that it constrains your attention. It captures your attention where that thing is the one thing that you're focused on. That scary thing, right? Like if you've ever gotten evaluations for anything, think about what happens. Like you might get 99.9% wonderful evaluations, but then there's just the one, right? That was terrible. And I promise you, that's the one you're going to focus on. And that's on purpose, right? Because as Kelly Wilson used to say, we learn much faster from an aversive event, one trial learning, than more positive events. And Kelly used to say, that's because you can have lunch every day, but you only can be lunch once, right? And so on purpose, we're built so that we're going to focus on the negative, which can be great. So the goal is to increase, just stay with me for a second. Like if we're going to use this shaping paradigm for shaping approach behavior in the presence of the fear cue, we want to increase variability in the presence of that fear cue, not to distract at all. In fact, we're going to encourage you to stay in contact with that fear cue the whole time and really notice what shows up and what thoughts you have about it. And we're going to encourage you to do more than avoid. In fact, we're going to help you resist avoiding and instead do all sorts of things, right? This is really different from kind of how our bodies would normally respond, but that's the goal. All right, so how do we do this? How do we shape this curiosity that we need about all the things we might be able to do in the presence of a fear cue? Well, if you're going to go from an ACT perspective, the first thing we want to do is really shape people's ability to really notice with their five senses, right? To really be in their bodies. Because here's the thing, if you're dominated by the mental events that are going on in your head and your verbal experience, even if you do exposure, if you may not learn very well from it, okay? So what we want to do is we want to start by teaching these foundational, simply being present skills, right? You want to shape the notion that emotions are information. They're not good or bad. You may like them or not like them, but they're just emotion. I mean, they're just information, So we want to teach that. And there's sort of from this developmental model, when you think about little kids, right? They begin to 3 to 5, they go to preschool and they start to label their experiences in a social context. And at around ages 5 to 10, they begin to evaluate good emotions, bad emotions based on what they're seeing around them. And we have a culture of sort of pushing away negative or bad emotions, right? And what happens is the advising part of us gets engaged in trying to problem solve too much, too little, too intense, too negative emotion, right? And that's definitely counterproductive. And so what we want to do is in the beginning, when you're starting to develop your therapeutic alliance, You want to make a huge space for like whatever emotions you're feeling are great, right? We want you to notice them. So we want to normalize whatever folks are feeling. We want to practice and skills. And is really simple. It stands for allowing, noticing, and describing. That's your affect labeling piece of supporting inhibitory learning, okay? And just allowing this, right? So when you think about how do you make learning really salient, you really want to have this deep learning where you're having lots of cues. And so affect labeling has been shown to support inhibitory learning. Practicing present moment awareness supports affect labeling. It can help increase emotion granularity, can help you build better exposure hierarchies, right? Because if people, sometimes when we work with very severe kids, right, or adults, it's really hard for them to like find any variations that you can make a hierarchy with. Everything feels huge, right? This skill set will help with that. And so that's really foundational, we think, to engaging in exposure. So how would you know when to do this, right? If we're going to support this curiosity about our private experiences, right? How would we know when we really need to teach this, or can we just start, doing the exposures? Well, here's what you might look for. Here's what I look for, right? Look for really impoverished emotion vocabulary, right? If you're having a hard time telling what you're feeling, if you're an individual who's struggling with OCD, or if you're a therapist, hearing a lot of, I don't know, I'm not sure, it all feels bad, or you're seeing just like a one-note description of emotional experience, anxious, more anxious, less anxious, right? That's a very narrow range of experience of emotions. So that might be a sign that we need to do a little bit of work on skills building here, right? You might hear, I've always felt this way. I'm never going to feel better. And so there's a lack of awareness that emotions come and go. They shift and change all the time, right? It's like when folks are feeling really intense emotions, they feel like they're stuck in it forever, right? That's not going to be helpful if we're supposed to learn, right, from an exposure that we can actually have all sorts of emotions. They come and go, and we can be perfectly effective in our lives if we choose to, right? Another one that's a deficit is really not being present. So having a hard time noticing whether you're actually here right now or you're off in your head somewhere, right? Stuck in your thoughts. And so when I'm training clinicians, I'm always helping them notice, like, when is somebody stuck in their head and when are they really with you? And how do you discriminate that in session? Time traveling, right? Predicting out to the future. Oh, I can't do this because this will happen, right? Or what if this happens? Or ruminating. Well, last time I did that, I was so triggered after that exposure that I don't want to do it again, right? We call that time traveling. It's another sign that we're not here right now in this moment, from a very stolid place, choosing the next step, right? Wishing the present moment is other than it is, right? Lack of acceptance. And then you might see, people engaging in ERP and not really habituating, right? And remember, we're still teaching curiosity and flexible adaptive behavior, but when you're having somebody do exposure and they're really not habituating at all, I start to get really curious about what's going on. Are they covertly avoiding? Because this, right, teaching how to be present is a great way. It's a great antidote to that covert avoidance, because you're teaching someone what to do, right? How to be present. And, in PE protocols and in that prolonged exposure paradigm, we would think about that as under-engagement, right? Not being here, being away, white knuckling. Okay. So how do we be curious? And these are some things that we might say to clients, right? About how to cultivate that curiosity, slowing down. Bring your awareness. We can do it right now, right? Slow down and just simply notice, What's showing up for you? What do you feel like right now? Step back from whatever story OCD is telling you and pay attention to right now with your 5 senses. And by the way, when you do that, look for something that will surprise you. So look at this picture just for a second and just notice what shows up for you when you look at this little guy. What surprises you about him or her? What sorts of thoughts are showing up as you observe this little creature? Right? He's just super cute, isn't he? He looks like he looks like a character in Kung Fu Panda. Adorable, right? We miss so much when we don't slow down and bring curiosity, gentle, open awareness to our experience, right? So practicing some of these skills with your clients that are struggling to get into their ERP is really helpful. Here are some really small things that we have in our book, Ben and I, to help shape this, right? Little things that you can do right in session to get people started. You can start small, just whatever, notice, bring your attention to your OCD, or it doesn't even have to be OCD, it can be something else. And just for 30 seconds, zero in on that not right feeling. Or you can see, can you take one step in the wrong direction and see how that works, right? You can notice how many things OCD says to you in a minute. If you give it a chance, get some sticky notes, write all those things down. Don't forget to include the things it says to try not to get you to not write this down. You can play with these, right? So all of these are very, very simple at the heart of it. Exposures, aren't they? Right? But what we're doing is we're shaping a different repertoire in the presence of the scary stuff. How do we interact with it in some different way, right? Okay. Here's another one that we really like when folks are really unwilling or not, to contact stuff with their OCD right away. And remember that, a lot of my experience of this is shaped by folks on the more severe end of the OCD spectrum, right? So we just teach it outside of the domain of OCD. That's it. And then we shift it over to OCD. So we might say, get a handful of ice cubes. Hold them. Notice what that feels like as they melt. That's it. Just notice. It's uncomfortable, right? When you're impatient in the store, allow yourself to notice that impatience, that frustration, right? That fear of, is somebody 6 feet away from you? Are they wearing their mask, right? Et cetera, et cetera, et cetera. And just getting folks to practice, like, how do you lean into hard things? How do you choose to do those things and be curious, right? It's very different from, I'm going to make myself do this. It's teaching choice right up in the beginning. Okay, so we're going to move on to willingness. This is a quote from Ethan, whose video you saw earlier, and I'll read it to you. He says, I remember the specific day that I told myself I would overcome my OCD. I thought about how many people will never experience something so difficult in their lives, and that this may be the most difficult struggle I ever face as well. After establishing that, I had another thought. If I could overcome this, if I could lean in and move towards helping myself, I could live the rest of my life knowing that I had conquered an adversity like any other. I could live with complete confidence that if I set my mind to it, I can do anything. That day, I went out of the house for the first time in weeks. That is willingness, right? And what you see that he did there was he thought about this really differently, right? Very different idea that this could be a teacher for me. And if I could do this, I could be the kind of person who really could do anything. That is of value. And that's one of the ways that we engender willingness. Okay. So when we think about willingness from a CBS, contextual behavioral science, or an ACT perspective, we are interested in willingness to experience, okay, willingness to feel things. So we would think that if you're unwilling to feel things, that's going to impair your ability to learn. And it's certainly going to constrain inhibitory learning, and it's going to constrain your generalization across different contexts. For example, an internal context. What if I just am willing to do exposures when I'm in a great mood? What if I'm not willing to do exposures when I'm sleepy or I have a headache or I just couldn't be bothered, right? We need to increase willingness across all of those internal contexts too if we really want to get full generalization, okay? So when we think about this in exposures, what I tell my folks is I do measure subjective units of distress when I ask about exposures. Some ACT therapists do not. The reason I do it is not because I'm interested in focusing on habituation, but I want to know what the expectation is for how hard this exposure and response prevention exercise will be, right? So I'll tell kids when I'm teaching them how to choose to move forward, I'll say, I'm less interested in a super high suds. I'm more interested in super high willingness. How willing are you to let this whole thing wash over you, right? Because if we're not willing and we're doing super high suds, right, exposures where they expect super high suds, you might get white knuckling, right? I'm just going to jam myself through this. I'm going to get through it as fast as I can. I'm going to walk on the ledge, but I'm going to look right at my feet instead of really letting the experience in. Okay. And so I initially start with prioritizing willingness over high suds. But then later on, what we want to do to really help with generalization is we want to do random exposures, over the top exposures, and increase people's bandwidth for being surprised, improvising, self-directing, and all of those things, right? I certainly will push if I'm given permission, and I often ask for that, to really coach very big exposures. And when I'm coaching and when I'm trying to shape willingness, sometimes I'll hear, I'm not ready, it's too hard. And what we do with that is, of course, we notice it as the advisor talking, or we diffuse from it as a thought, right? That's a neat thought. Yep, I can understand why you have that thought, that'll be too hard. Can we notice the thought and move forward anyway? So I try not to get in that tug of war with the, but you are ready, I'm not ready, right? I don't want to get caught in the content. I want to treat it functionally, right? Like, yeah, that's a thought that often occurs when people are about to do something really brave. Let's go. All right, so I'm going to show you a little tool that I developed in my clinic. That's a really simple way to teach very contextualized exposures. We don't have a great name for it other than the comfort versus discovery zone model. So apologies for the clunky name. But this is a little worksheet that you guys can make yourselves, you can use, and if you use it, love to hear how it works for you. But so far, we've noticed that the young people that we use it with really love it, and it's very effective. We run groups based on it and things like that. So the first thing we ask is about the things that give you vitality, right? And that's another way to ask about valuing those things that we care about. And then we have our little comfort zone drawn as a little small space. And then we have our larger discovery zone. And so how we fill this out is we ask the following questions. Okay. And I would suggest asking them just like this, right? So if we think about OCD, what are the things you do to keep yourself in your comfort zone, right? And so have folks write out the answers to that in that little blue circle, just in that little blue circle. They'll have to write really small, okay? Then you ask, how comfortable are you in there? right? So like going back to the example of the mountain trek, all of my comfort behaviors were going really fast over the steep parts, kind of avoiding inside the experience of fear, lots of probably self-reassurance statements, looking down at my feet rather than noticing. And while doing that, it was actually not comfortable at all. I was still just as scared as when I started the trek. And asking it in this way is there's an intervention and act that we call creative hopelessness. And the purpose of it is to undermine engagement in avoidance behaviors, or as we call them, control strategies, right? So, and you ask it like this, so you actually get it at an experiential level, right? Like, am I comfortable? Right? And you're asking them to reflect on their own experience. The next questions are, what are things that you would really like to do that are important to you that you don't do or can't do while you're working on being in your comfort zone? Right? And you would write those in that larger discovery zone of your little worksheet. Okay. So for me, it would have been noticing the scenery, taking pictures, actually being with the people I was with instead of like obsessing over whether I was going to fall off this ledge. Right. I wasn't doing any of those things when I was working on avoiding my fear of heights. Right. So number 2, and the perfectionist in me is noticing the typo. Hate it, but good exposure. What's one small thing you might choose to practice doing outside of your comfort zone to take a step towards these things that matter to you, right? And here's the thing. In order to learn, you have to be willing to be uncomfortable. Otherwise, you're not going to learn anything. In any area of life, whether OCD or not, we have to choose to be ready to discover, ready to fail, ready to fall off the ledge. Hopefully not, but you never know, right? And it's all about choosing to do those things on purpose. That's what we want for an exposure, right? So you can, this is a great way to discuss when folks are through treatment, or if you want to just have a gentle start to your exposures, what's one small step? And then they self-generate a hierarchy that they can then keep going with and see how they learn. And you're really putting them in this place where we're using language like explore, discover. We're really pulling for curiosity and we're really pulling for willingness. And we have, you have to stop, engaging in those comfort-related or avoidance behaviors in order to be in full discovery zone. Okay. So the goal of all of this, right, this model that we are talking about now in support of exposure and support of inhibitory learning is really supporting adolescents or anyone really in using language flexibly to engage in workable values-driven behaviors, right? And that is exposure. So what we might do is, in addition to this, we might think about how we talk about these 3 classes of behaviors, or these 4 classes of behaviors, I guess, if you're thinking of valuing too. And you might step away from your advisor. You might use some metaphors like advisor is OCD. That's a really flexible way to use language, or anxiety monster, right? We used to have kids call it the committee or the mean teacher, right? So you're doing this nice separation. And that's something that we see in CBT approaches to ERP2. If we go back to, the Franklin, Freeman, and March book, the March and Mull original book for kids and teens. And this is something that's very useful for adults too, okay? We'll return the individual's attention to the workability of their behavior, right? How comfortable are you in your comfort zone when you're avoiding? Is that workable? Can you engage in these things that you care about if you're focused on this other thing, these avoidance behaviors, right? That's workability, just demonstrating that trying to avoid stuff inside your head, unworkable. And not only that, not only is it unworkable, but it also constrains you from building a life that you could love. And then we encourage moving into this discovery zone. And, to kind of put that in a nutshell, what we're teaching is willingness to do trial and error learning, which is something that OCD just stops, right? Because it just wants you to do its rituals. And you never learn. You don't have the opportunity to actually be in the world and see what would actually happen. That's what we want, right? So here's how we might actually make a hierarchy using that little model that we were talking about, the comfort versus discovery zone model, right? So let's say areas of vitality in a young person's life are my friends playing football and learning science. And so they might come up with, all right, what are the things I do to keep myself comfortable? And we're going to resist those, right? So not speaking up in class, avoiding trying my best at soccer because that might make me stand out, and video games by myself when I'm anxious. I hide. I just play video games. And so here are the discovery behaviors to explore. This is the exposure, right? So we have the response prevention in the first column. We have the exposure in the second column. I'm going to ask a question if I don't get something because I like science. Cool. You know what? I like football. So I'm going to actually really play just for 10 minutes, and then I'm going to give myself a break. But for 10 minutes at this game, I'm going to really play with my whole heart, right? And then when I feel anxious, instead of going gaming, I think I'm going to meet a friend to practice football, or I might text somebody. And we look at willingness, and we can start with that, right? So if it's low willingness, I wouldn't start with math. I might go to meet a friend when you feel anxious. And then I might play real hard for 10 minutes and we'll see how that goes. And so what you're doing is you're really shaping approach behaviors in meaningful, valued areas of life, which hopefully are going to be really reinforcing for that person. And again, you can use this kids, teens, adults. All right. So let's talk a little bit about learning flexibility and how we take perspectives on ourselves. Okay. Lots of times when I'm first talking with folks with OCD, it feels like they are their OCD, and it feels like OCD is forever, right? I am an anxious person. I can't do this, right? But I want to bring your attention to this really great quote from Michelle Obama from her book, Becoming. Now, I think it's one of the most useless questions an adult can ask a child. What do you want to be when you grow up? As if growing up is finite. As if at some point you become something and that's the end, right? And the reason that this is important is something that Carl Rogers also knew in his client-centered work, is that the good life is a process. It's not an outcome, right? We're always becoming because we're always behaving and we're always influenced by a stream of events that are happening, inside us, outside us. And so there are always opportunities to learn and to grow. And we can really take that wherever we want. Okay. The problem is sometimes we can get stuck in an idea of who we are. And this is really relevant when you think about OCD, when folks are stuck and they're having a hard time moving forward with doing exposures, okay? So we construct our idea of who we are based on our learning histories in a social context. I learn who I am because when I'm a little kid, I notice other people around me and I start to think, well, I'm short because so-and-so is tall. I am a cis female because he's a cis male, or whatever, etc. And we derive our sense of self from our social context. And we get an idea of who we are. I'm a psychologist. I'm a mom. I like to do some writing. I'm a little bit airheaded sometimes. I really, really care deeply about the people who are my staff and my clients, and they're amazing, right? And this self-concept that we gain, how you describe yourself to someone else, can be useful if it helps you engage in valued behaviors. But it can be super unhelpful when it tries to solve our history, right? Think about cognitive rituals. Think about rumination, right? And this part entails getting stuck in our advisor perspective, okay? So this concept is also unhelpful when it tries to solve core beliefs about, am I competent or am I not competent? I don't know. Can I figure that out? What would I need to do, right? Because it's all in our head and it constrains us from acting, right? So what we want to do is we want to shift people. We want them to notice that kind of self-talk that's going on, the way they're interacting with the self-concept, and move them into actually action, doing their exposures. So a flexible self-view then is understanding that this idea I have of myself is an idea. It's part of me, but it's not a literal truth, right? We're more than our OCD. Okay, I'm more than a psychologist. I'm more than a mom. We're much more than that, right? And understanding, like Michelle Obama and Carl Rogers do, that we're always becoming, and that our past experiences, our past trauma, our past history doesn't define who we are. It's something that's part of us, and we can learn and grow from it. And noticing that we can step out of that story, right? Because that's sort of a comfort zone thing, isn't it? Like behaving consistently with the story you have of who you are. And stepping out of that into the discovery zone, right? So we can let go of stories that are unhelpful. Here's an unhelpful one. I need to be ready in order to engage in ERP. That's a good story, and that's not one you want to attach to, right? Or I have to be less anxious in order to have a life. Also not a helpful story, because anxiety is going to visit us all at different parts of our life, right? And so another way to be flexible in your self-view is to notice, right? Step into that noticing space. Notice the world with your 5 senses. Practice your present moment awareness, your acceptance. And from that space, choose your next steps. You don't need to let the advisor choose for you. Okay, so this is a little tech jargony, but it's probably worth thinking about. And so when we think about flexibility of who we are, right? And again, this is something that can really underpin engagement in an exposure-based protocol, is notice that you have many experiences and they're going to shift and change. And just really notice that variability, right? That's going to support inhibitory learning again, because it's going to really help people notice nuances, notice habituation when it occurs, notice what it's like to handle this really hard thing that you didn't think you could handle. It also promotes the development of noticing this observing part of us, right? This stability, that we always have this noticing space or this observing space that we can kind of step back to and step back from, our very chatty OCD or mind that's always evaluating us. And so, again, making this kind of hierarchical distinction. I am not my thoughts, right? I am not my OCD. That it's part of me, yes, and I might contain all of it, and it's not all of me. It's a component, right? And so noticing also how you're interacting with yourself, right? Because that makes the possibility of choice for how we talk to ourselves, which we'll get to in a minute. And then noticing how our behavior affects others in our context. Here's some little tricks you can use to facilitate ERP when you're working with someone and they're stuck. One of the cool things about being flexible is you can use your imagination. So if I'm really frightened of something right now, I might say, I might imagine, what would me 10 years from now, who totally kicked ass with this exposure, tell me to do right now, right? And so you're kind of creating this imaginary, self that can give you advice from the future, which is a kind of cool thing. Or another one we use sometimes is, let's say little you is here, little younger you, and what does little you need? Can you help lead him through this really hard exposure and let him know he can do it, right? That's another way we can kind of think about facilitating this. And so other examples are, they're all over the ACT literature, like you're the same self you are now in your best moment as you were in your worst moment, right? That noticing place is stable. Your experiences are impermanent and fleeting. And then we talked about the last two, me and my thoughts, and then shifting across the perspectives of the DNAV. And in the interest of time, I was going to do this exercise with you all, but what I'll do is describe it. And it's quite powerful. And I encourage you to try it at home and certainly bring it into your clinical practice. We call it the critic versus the kind coach. And it's from the self-compassion or the compassion-focused literature. And I first heard it from Dennis Church and Laura Silverstein, where the advisor can be a very critical voice, right? And so we would invite a client to take 2 minutes, imagine themselves in a situation where they were struggling or maybe they disappointed themselves. And on one piece of paper, on one side, to write for 2 minutes a letter to themselves in the voice of the critic. And just have them notice what that's like. After that, we would have them imagine a kind coach, a kind and wise coach, right? And then we invite them to write on the other side of the letter, or the other side of the paper, a letter to themselves from that voice, and notice that experience. Now, this exercise is particularly useful for folks with perfectionism, who are sometimes very attached to the idea that they have to have a critic, otherwise they won't excel. And to do this kind of experiential exercise really highlights, like, well, which one's more effective? When you think about these two voices, which one are you more willing to work for? Which one do you feel more demoralized under, right? So it's an experiential way of getting them to notice how that self-talk really works. And once they notice that, right, again, noticing, right, they can choose to shape and cultivate a kinder, more self-compassionate relationship with themselves. So that's a lovely exercise. All right. So coming into the home stretch here, and we're going to talk about valued exposure, which is really neat. This is a quote from another young person that we've worked with, brilliant writer, and a young person with lived experience in OCD. And she says, it took me years to learn that I had to be the one to make the change. No one else was going to do it for me because no one else had that ability. If there's one thing you take from this, I hope that's it, that you have the power to make your life better, but it's your choice. Okay. So I do want to take just a moment. I'm going to give you 60 seconds. And I want you to think about, for you right now, what makes a good life? And if you have a pen or a piece of paper nearby, I'd like you to write it down. And again, we're just going to do this for 1 minute. You can go ahead. What makes a good life? Just write down what comes to mind. And just wrapping up whatever it is that you're writing. Just have another few seconds and then we're all set. Okay. So that, what you just did, was a really simple values exercise to just connect in with this idea of what would a good life be for you, okay? And I want to talk a little bit about what would be the purpose of incorporating that into exposure. Well, there's a little bit of data on this, shockingly not tons, but the thought is that engaging someone in meaningful pursuits and having those present in one's mind while they're undergoing exposure can serve as a retrieval cue, potentially, to remember to lean into the hard things. It's also something that can transform the function of engaging in exposure from something that someone has to do to something one wants to do. And that's something that Ethan talks about, right? So we do know that it's useful. There have been a few studies that have shown positive effects of framing exposures of various kinds across various issues like anxiety to help with outcome. But there was a study that was undertaken by our fabulous postdoc last year, who's now running her own clinic at Emory, Rebecca Schneider, who looked at values and exposures, and she compared it with a condition where people were paid to do exposures. And just to be quick about this, and she will be putting this out soon, I hope, so hopefully we'll have something to read in addition to just her whole dissertation document, was that although both conditions were effective in helping people engage in exposures, only the values condition, the intrinsic reinforcing condition, led to engagement in novel exposures, which suggests to me that it may be really helpful in generalizing and supporting generalization, right? Okay, so deeper dive into valuing. What do we mean when we say valuing? And I realize that we're getting short on time here, so I'm going to speed up a little bit. A statement of values articulation can either increase or decrease the reward value of a behavior, right? So if I'm doing something that's consistent with my value, that's going to increase the reward value of engaging in that behavior. But if I'm avoiding and that's not consistent with my values, I'm going to start to be less in love with those control and avoidance strategies, okay? Values are chosen. They refer to a quality of action, okay? They're not something that you as a therapist would tell your client. No one can tell you what your values are. They come from you, from inside. They're constructed, right? They're things that we derive based on the things we think are meaningful in the world. But most importantly, they're actions. It's not just talking, it's acting. It's moving forward in a direction. Okay. So for some people, right, and this is sort of a developmental look, because adults tend to be more clear on their values than younger people. Here are some areas that we might listen for values in connecting with others: giving, having a positive influence, being active in our lives, embracing the moment, learning, and self-care. And when we think about this, and when we think about applying this to an exposure-based paradigm or an exposure and response prevention paradigm, success means engaging in behavior aligned with your values, whether or not there's an OCD there. Go for it. Some questions we might ask to get people in touch with their values are these. And you can do values work just through conversation, or you can do little writing exercises like we did. You can do imagination exercises, and there are many in the ACT literature. And to actually get people to connect in with their values in the context of an exposure, you might just teach this little skill here. Breathe and slow down. Observe your feelings. Take a second to check in with your values. What's the most important thing here? And decide on what kind of person you want to be in this moment. Do you want to be someone who's about avoiding and being safe? Or do you want to be the kind of person who's going to move forward in their life? Okay. So one of the things that's useful, and we're back to our Everest trek, we're going all roads lead to Everest, it seems, is think about this in the context of exposure. And this is something that Ethan talks about in another video, about making a promise to yourself that really matters and then taking a step in that direction. So in the context of an exposure, it might be, let's say, social anxiety exposure, right? You get anxious in conversations, and a value is wanting to connect with others, right? So you might make a promise to yourself, no matter what, that you're going to go and interact at a party and you're going to ask 3 people questions, or you're going to find out something interesting about each person that you talk to, and you're going to talk to at least one person, no matter what, right? And so making a promise to yourself, doing that sort of verbal behavioral contract is going to help adherence to whatever that exposure is. It's also going to promote flexibility, and we're ending with this idea of variability in behavior. Okay, here's another quote by Ethan that I really love. He says, "The first step is not the hardest. I think it's certainly hard to take that first step towards facing your OCD and your fears, but it's not the hardest or the most important. The hardest step is the second step, and the third step, and the fourth, and all the steps that come after that." And I love that, because when we teach ERP, it's about changing your relationship to, this avoided content forever, not just during the course of treatment. It's really shifting, it's transforming your relationship to this stuff such that it doesn't evoke avoidance, it evokes leaning in when that matters to you, when avoiding it gets in your way. And that, my friends, is what we mean when we talk about the discoverer and being in this discovery, this learning zone, right? And only in allowing yourself to be in that space where you're curious, you're willing, you care about things, is where you're going to make discoveries about yourself that you never dreamed you could do. Okay. So this is the heart of exposure, this discovery piece, right? An act, this moving into valued action and committed action. So it's really adaptive risk-taking. So you can learn what sorts of things, what sorts of activities are going to enhance your life. And you might rely on your advisor or not. Your risk-averse advisor is always going to advise against going too far into discovery. So that's where you need to step into your noticing space and see how it all works. And again, that's going to support expectancy violation and inhibitory learning. So being in this space and really noticing how your behaviors work, right, is what we call tracking. Really noticing the effects of your behavior on the environment. And this helps you build and find strengths. So skills deficits here in shaping flexible repertoires would be, you're not adapting your behavior to the context, right? You're doing OCD stuff, you're doing rituals, or maybe you have a past trauma that shows up for you in the present, and you're, behaving as though it's happening now. And that's a very narrow, rigid repertoire. So there's a lack of curiosity, lack of willingness to explore, right? Unhelpful patterns and unwillingness to make room for risk and discomfort. So all these things that we kind of have talked about working up to this point. And so from an ACT perspective, it's the same, it's very consistent with, a traditional ERP perspective. This is how we would move towards flexibility in our paradigm. You'd make a promise to yourself that really matters. You might start small, do the hard stuff, don't do rituals, and repeat over and over and over again. And in every context, even internal context. And so this helps us transform that what if of uncertainty, right? From something scary to something that's filled with awe. And that's really cool, right? So here's our psychological flexibility slide. And I want to just talk a little bit about what we call transformation of function in exposure. How do we shift from I have to avoid my rituals or I can't let myself do them to I want to explore the world, regardless of fear. And so I'm just going to ask you to think about all the relations that we derive, all the meanings we attribute to anxiety, to stress, to fear, right? How do those organize our behavior, right? If we think anxiety is negative, how does that organize our behavior? If we think about it as information, how does that organize our behavior? So you want to think about what you might say to transform the function of some of these experiences such that they evoke approach and discovery and flexibility and curiosity and willingness instead of avoidance. So here are some really specific things that you might think about saying to yourself if you have OCD, or if you're a therapist, to your client, to prompt curiosity, right? Slow down, notice. What surprises you? What didn't you expect? Where did you feel that, right? To prompt willingness. What is that OCD thought telling you to do right now? What if we did the opposite of that? What if we make a space for that discomfort? What if we soften around it? Why don't we see what happens? We're noticing that thought. Why don't we see what happens next? And then for prompting flexibility, if you're feeling anxious, that's a perfect opportunity for exposure. This is a really big step towards your freedom. What a chance here. How amazing, right? Notice all of the stuff that you're experiencing. We don't need to change it at all. All we need to do is step back, think about what we care about, and choose. And discriminate, like, what are we up to? Are we about avoiding discomfort, or are we about really moving into our values? And this helps create some new rules, right? As opposed to maybe those original ones we've derived about OCD, about recurrent intrusive thoughts, about anxiety. Think about this metaphor of being an explorer, right? What makes someone good at exploring? Not being afraid, not feeling ready, and definitely not knowing things for certain, but it's all the things that we've been talking about and something really powerful to go after, something that's really inspiring, that makes being afraid worth it. So that leads us to increasing our skills in these areas that we've talked about, of our three classes of behavior. And I'll just kind of go through these quickly. Okay. Skilled noticing, allowing, fine-grained awareness of our experience, and flexibly directing our attention. We don't need to watch the spider. We can let it do whatever the heck it's going to do, and we can choose to allow it and move into values. And we can see how our behaviors work, right? And we can build our strengths as we go. Strengths that you might not even be aware of if you haven't been living in the world. Instead, you're living in your head. And then finally, noticing how all of these things work in the context of ourself and our social view. Okay, so I'm going to skip ahead to the end, and I'll end with this really beautiful quote from John Green, whose young adult novel, Turtles All the Way Down, if you haven't read it, is about a young person, a young protagonist with OCD. And he says, spirals grow infinitely small the further you follow them inward, but they also grow infinitely large the farther you follow them out. So my hope is that at least some of the material in our talks today will be useful to you in your practice, or if you're struggling with OCD in your life. Thank you so much for attending this, and be well.
All right. Thank you so much, Dr. Coyne, for your presentation and for shedding light on enhancing ERP with ACT. We have some questions. Are you ready?
Excellent. I'm ready.
All right. So someone has a question about facilitating new learning. And she asks, what if the feared situation requires higher order thinking, for example, academic conversations, giving a talk, etc.? When the fear results in sympathetic nervous system overdrive, the frontal lobe activity is depressed, and the word finding, decision making, etc., actually does suffer. In these situations, the fear and anxiety may actually make us less capable of succeeding, and the new learning may not happen. It seems this situation could strengthen old learning rather than inhibit old learning. How would you work with someone in this situation?
I was that person in that situation, actually. I used to have panic attacks when I gave talks, straight up. So I have been there when in the middle of a panic attack, I couldn't remember the beginning of the sentence I said. It was like, oh my God. And just wishing it was over and knowing I shouldn't run out of the room, right? Here is the trick with that. If there's two ways you can approach that. And one is to go and try and be in that situation and manage your anxiety. The other is to choose. It's to say, this is going to make me anxious. Maybe I'll have a panic attack. And I'm going to choose to teach well. And I'm going to focus on doing what a competent teacher would do. Whether or not I'm a competent teacher, I have no idea, because I've never actually been present in a talk because I've had panic attacks up to now. And here's the thing, right? Once you let go and accept that you will be anxious, yep, and your higher order thinking will be shut down, yep, maybe, maybe not, let's see. You're experiencing that in a different context than you previously were, one of willingness, one of allowing. And what I can tell you is, here was my trick. I would say, okay, I'd start to panic and I'd go, I can either make this about me trying to hide that I'm panicking, or I can focus on teaching well. What would a competent teacher do right now? And usually the first thing was making eye contact with my audience, which was terrifying. And I would do it. And then the next thing I would do is say, I think I might have a panic attack, just letting you know. Keep making eye contact. And somehow, once I let all that cat out of the bag, it was okay. I was still anxious, and I focused on teaching. And over practice, I kept teaching and teaching and teaching. And I just kept taking a step in that value direction. And it's very rare now. Well, here's the thing. It doesn't matter if I panic or not. It doesn't matter if I'm anxious or not, because really that's not the thing that's the most important to me in these. The thing that's most important is being of service and communicating effectively. So I'm actually willing to have a panic attack. Like if you guys ask me a really hard question and I look like an idiot, I might panic, maybe. I don't know. We could see. We could try it. But it wouldn't matter, because that's an emotion, and that's actually not what I'm about right now. I want to make sure we teach this well. So try it and see. And you may not know the answer for exactly how it works, before you do it. And one thing I tell my clients all the time is I can tell you all day long how to ride a bicycle. You're not going to know how to do it until you get on. So try it and see what happens and practice it. It's a practice, right? So it's not just a one trial learning. It would be strengthening the competing learning, the opposite direction, if you did it once and bailed. That's true. So keep it up.
And in therapy, in what situations or how do you decide when to formally teach mindfulness practice?
I almost never formally teach it. So for me as a therapist, I work very, like the foundation of kind of the work that we do is I really want to know this person in front of me, and I really want to pay really, really close attention to what's happening in the room. The moments that I feel like drawing their attention to noticing is when they're really mindy, when they're really in their heads, when they're spinning, if they're telling me a story that I feel like feels very familiar and like a reason for why they can't do something or why it's too hard or they have to explain something. I'll say, just slow down for a second. What are you noticing right now? And when they come back, I'll welcome them back. And then I'll just teach them that little discrimination between kind of being in their heads spinning versus being here now. Because if they're here now, I can help them choose that next step forward that might help them. So other than that, rule of thumb, I usually start with sort of present moment awareness early on, because I think it's foundational to exposure. I think you need to be in your body while you're doing exposures if you're going to learn from them effectively.
So it sounds like you really use ACT in this way as a very process-based approach.
Absolutely. Absolutely. And that's how we teach it in my clinic too. It's very, just after having known it for a long time, having learned it like right at the beginning, it's very flexible at this point. It's very integrated in ERP and behavior analysis. So I can I trust that all that the tools and the techniques are in there somewhere, and I can pull back and get the one I need when I need it. But the most important thing is just paying attention, because that's when you're really going to get the most information and be the most effective, I think. I hope, anyway.
And that might push some ERP therapists out of their comfort zone too, since ERP can be pretty rigid in terms of procedure.
It can be, exactly. Yeah. We do it very flexibly, but in deep contact with whatever the core fear is all the time.
So someone asks, what if a client can't think of the things that they're not doing that they want to do because of OCD and their comfort zone?
That's a good question. I think what I would do is I might do in session, I might invite them to describe their week to me. The best point maybe, and the lowest point. And what was it about the lowest point? And then outside of session, I might say, so now I want you to really notice those low points and come back and tell me about them. And I might start with that. Or I might just listen for, what was life like before one was so stuck? Can you remember, right? Or if it's really hard, and sometimes people really are stuck, I'll say something really simple like, if you could have chosen your life, would this be it? And if the answer is no, why not? And we start there. And then kind of just through asking questions and listening to that, hopefully we can find some things that really matter.
Can you talk a little bit about how you like to work with creative hopelessness when people are really stuck and convinced they can't improve?
Yes, and that's a really important ACT intervention. So creative hopelessness is about facilitating somebody feeling stuck, right? It's about really letting them open up to how stuck they are, and then having them, being very clear that they are not hopeless at all. but the strategies that they are using, they're tracking. They're actually accurately noticing that they're not working. It's really hard and really, to manage thoughts and feelings, and it's exhausting and it doesn't work very well over time. So the way to get to that stuck place is really simply to interview about, what do you do when that shows up, that scary thing? How does that work? Does it help? And usually the things that people choose to do work well enough in the short term, but long term contribute to that sense of stuckness, right? So sometimes people cheerlead when folks are feeling hopeless. That would be not consistent with a creative hopelessness intervention. That's really about saying, yeah, it does suck because these things don't work. You're right. You're tracking that. You are right on top of that. And what if there was a different way? And so sometimes people need to feel stuck for a little while before they kind of have that aha moment where they're like, oh, wow, what if I did something differently? And sometimes it's like a light going on and it's just so different. It's hard, but it's no harder than what they're already doing. And that's another thing to notice, is that it's hard, but it's paying for a purpose.
Can you talk a little bit about the concepts of fusion and diffusion? Someone says that she's working with a client who highly values control in all areas of her life. Her system prevents pleasure, spending money, etc. How do I help her distinguish between her OCD thoughts and her real thoughts and values?
That's a good question. And I wouldn't go to fusion for that, actually. I would go to present moment awareness instead. And here's why. OCD is coercive, right? It gets you to do what it wants you to do by giving you an experience that is really aversive. So when you do what it wants, it goes away, right? That's the negative reinforcement model. And so OCD feels like a have to, and there's like a little bit of a relief after it. That feels very, very different. Like if you ask someone, is there life in that feeling? Do you feel vital when you're doing your rituals? They would most likely, I would guess, say no, right? And so for your client who's into control, she might be experiencing this sense of relief briefly, but it's like a hamster wheel that they can't get out of. And so I would ask them, like, when's the last time you felt really alive? Where were you? And it might have been even fleeting. It might be just a small thing. That space, right? That is like, so following a value is more positive reinforcement in the sense that you might feel that greater sense of vitality, meaning purpose, right? It's an appetitive versus an aversive. So it's something we work for. It feels really, really different. And like Ethan's example of the roller coaster is a really good example of that, right? I feel forced into it. I choose for me. So I would have her practice noticing, when does it feel like a have to that you're doing this stuff? And when does it feel like you're really choosing and you have this sense of expansiveness and value? When's the last time you want that? Do you miss that? And so I would kind of teach that discrimination instead of diffusion right there.
Great. Thank you so much. We have so many wonderful questions here in the chat and in the questions and answers box. Thank you everyone for contributing.
Thanks, guys.
All these great questions. Dr. Coyne, thank you so much for
My
joining.
pleasure.
For your wonderful presentation and for being here with us to answer questions. We are going to invite everybody now to hop over to the session 3 link so that we can join our panel and hear from our panelists today.
Excellent.
Thank you so
Bye,
much.
everyone. You're welcome. Take care, everyone.